morning.
Good morning.
My name is Miracle. I'll be your nurse today. Can you state your name and date of birth for me?
Jada Flowers, birthday 01/21/2000.
And your age?
25.
Okay, and can I check your arm?
Mm-hmm.
Okay, I'm gonna pull this curtain for privacy, okay? I'm gonna check the orders and see what the doctor has for us to do, okay? Okay, so the doctor has ordered a assessment of your heart, your lungs, and your eyes, your ears, and I'm gonna check some other extremities like for edema, your peripheral vascular section, which is your legs as well, and I'm gonna check a couple of pulses on both sides. We also gonna check some range of motion in your arms and lower extremities as well, okay?
Okay.
But I want to ask you, are you in any pain today?
Yes.
Okay. On a scale 0 to 10, 10 being the worst and 0 being no pain at all, what type of pain are you in?
I'm at a 3 right now.
Okay, and where is your pain located?
In my right knee.
Okay, and when did it start?
About 2 weeks ago.
Okay, and what were you doing when it started?
Running.
Okay, and is it anything that makes it better?
I'm taking Tylenol 2 times a day.
Okay, and is that Tylenol over the counter or you got it prescribed by the doctor?
Over the counter.
Okay, and is it anything that makes it worse?
Nothing other than running.
Okay, and Tylenol is the only thing that you do to it? Okay. Also for safety, because you're saying that you have pain in your knees, I definitely don't want you to be at fall risk or anything, so make sure that you wear slip resistant shoes and that you are moving anything in clutter out of your way, and out of your way of the path that you're walking, okay?
Okay.
So I'm gonna go through and do your test now. I'm gonna start with your eyes, okay? And you just follow my commands with me, okay? So I just want you to look forward for me, okay? All right, and I'm gonna check your right eye first, okay?
Okay.
So just kind of tilt your head up just a little bit and just look forward, okay? And try not to blink for me, okay? And what I'm checking is for the roundness of your pupils, the evenness, and accommodation to light, and to make sure that everything is clear, okay? So I'm gonna check on the opposite side of the eye, okay? Okay. Okay. All right. So I'm gonna want you to look at this pen, and then I'm gonna bring it in close to your eyes. Just make your eyes move, not your head. Okay. You ready? Okay. Thank you. All right. And if you could, I'm gonna check your JDD, which is your jugular distension, to see if you have any fluid in your neck. Okay. So I want you to look that way for me. If I mind if I touch your hair?
No.
Okay. All right. And I'm gonna do the opposite side, okay? Look that way for me. Do you mind if I touch your hair on this side? Okay, good. And have you had any trouble with your eyes? And do you wear any glasses or anything like that?
No.
Okay, no trouble, no infections or anything like that?
No.
Okay. All right, I'm also gonna check your nasal and your nares, which is your nose, okay? So you just don't have to do anything. I'm just gonna look, okay? Okay, good. And if you could open your mouth, have you had any coughs or nose sneezes or any bloody noses or anything like that? No. Okay. And do you have any false teeth?
No.
Have you had any trouble with any chewing or any sore throats?
No.
Any sores in your mouth?
No.
Okay. Open wide for me and say ah. All right. Thank you so much. Okay. So I'm gonna put on my gloves, I'm gonna get hand hygiene again, put on my gloves, and I'm gonna palpate your head just to check. What I'm looking for is make sure that your head is symmetrical and that you don't have any lumps and bumps. Is there anything in your head that I need to be worried about, like lesions or sores?
No.
Okay, I'm gonna lightly palpate, okay? Let me know if anything hurts, okay? Okay, does that hurt?
No.
Okay, good. All right, so I'm also gonna let you look straight ahead. I'm gonna check your symmetrical of your neck, where your atoms and everything is, your throat, okay? Everything seems to be in line, okay? All right. Does any of that thing like that hurt? All right. So if you hold your arms out for me, I'm gonna just feel a little bit for edema. Okay. We do the same thing with your legs, okay? On both sides. All right. And while I'm down here, I'm gonna go ahead and check your range of motion of your knees. So flexion your knees to go back, okay? Alright, so I want you to flex back for me, okay? Alright, then come back. Alright, go back again. Alright, good job. Don't want to do too much on that knee since it's hurting you, but you do have good range of motion. And that one, I'm gonna do it actually on this side as well. Go ahead. That. Alright. Once again. Alright. And what we just did right there was flexion and extension, okay? So we're gonna test your range of motion on your top extremities as well. So if you would just look at me, we're gonna do subnation, then pronation, but we're gonna do one at a time, okay? So we'll start with the right. That's subnation. Then I want you to try to rotate it this way, this arm. Yes, ma'am. So bring your elbow up just a little bit. Yep, extend it like this here. Okay, keep your fingers straight for me. That's subnation, pronation. Subnation, pronation. All right, good range of motion on that side. Let's do the same thing on this side. Keep your hands straight, arms straight out. Subnation, pronation. Subnation, pronation. Good job, okay? So now I want you to look straight ahead, and this is called the whisper test, okay? I'm gonna state 3 words to you, real light, and I want you to repeat them after I say all 3, okay? Wait till I completely say all 3. Do you mind if I touch your hair?
No.
Okay. Hand hygiene again. Okay. Okay. All right.
Monday, Tuesday, Wednesday.
Okay, good job. Let me go on the other side.
Monday, Tuesday, Wednesday.
Okay, and have you had any pain in your joints?
Just in my right knee.
Okay, and have you had any pain with your ears or any drainage?
No.
Okay, and you hear well?
Yes.
Okay. Any problems with your throat?
No.
Okay. All right. Any problem with swelling over time other than today when I didn't see any in your neck, in your upper extremity? Okay. All right. So I'm going to listen to your heart as well, and then I'll check your pulses. I'm going to check your lungs as well, okay?
Yes.
Okay, if you could lift your breast up on this side. All right. And I just listened to your aortic, pulmonary, your ERPs, your tricuspid, and your mitral, okay? And so now I'm gonna listen to your lungs as well, as we go down, okay? And have you had any chest pains or anything like that, unfamiliar, like palpitations or anything?
No.
Okay, good. And I know I can't check your capillary refill because you have nails, so I'm gonna check them on your feet, okay? So I'm gonna remove your socks. I'm gonna leave them off because I'm gonna check your dorsus pelvis pulse down here as well. But I want to check your refill, and you have nails on your feet, so I'm just gonna use your foot to do that. And if you would turn over and see the bottom of your foot. Okay, good job. Thank you. I'm gonna do the opposite side as well. And I'll put your socks back on when you get through. Pick it up. All right. Get less than 3 there. And I'm gonna do, if you turn your palms in your hands, I'll do it as well. Okay. All right. All right. Thank you much. All right, I'm gonna listen to your lungs now, okay? Then I'll check your pulses. All right, and just breathe normal for me. And we normally do this on bare skin, but since we are in the office, we'll do it this way. Deep breath one time. Okay. Okay.
Okay, and if you lift your breast up for me.
Both.
Yes, please. And I'm just listening to your upper lobes up there, okay? And if you would, take this hand, grab that shoulder, and swing your legs around that way. All right, grab it nice and tight for me. Okay? Breathe normal for me. Okay. All right, and if you would do the opposite side the same way. Take a deep breath. Good. Stay that way for me. Listen to you at the top of your back. Okay? Breathe for me. Again. 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 And again. Okay? Thank you. Turn around for me. All right. Now, I'm gonna check your pulses on both sides of your body, okay?
Okay.
So if you would just turn your arm around for me. All right, 64. All right. Let's do this side, okay? Plus 2. Okay, and I'm gonna check your pulse here. Just relax your feet for me. Sometimes it's hard to find on here. Let's see if I can do it. I'm going to grip this. Yeah, okay. Okay, got to push a little firmer there. There we go. Okay, and with your respiratory, I know you say you're not having trouble breathing, but they did get you an incentive spirometer. So I'm gonna show you how to use it. This is the incentive spirometer. And what I want you to do is inhale like this 10 times per hour. The easiest way to do it is to do it in between, because you like watching TV, right? So when a commercial come on, you do it during that time, so you can get your 10 in, okay? That will help strengthen your lungs, okay? To help with sputum in your lungs, I want you to turn, cough, then breathe, okay? That helps expand your lungs and help get rid of mucus and sputum, okay? So if you ever have any with that, okay? So we'll put this back for the moment, okay? So that's to help your lungs, okay? So let me just make sure everything on the order was done. Yeah, I just want to make sure that everything the doctor had ordered was done for you. And there's one more thing I didn't ask you. I want to make sure that you're not allergic to anything just when the doctor comes in, to make sure if he's writing anything. So are you allergic to any medication, over the counter? Or okay, so are you taking anything else over the counter besides a Tylenol 2 times a day? Any prescribed medication to you?
No.
Okay. Well, I think that's everything that the doctor would want for you. Just make sure that if there's anything else that needs to be told you, let us know, okay?
Okay.
All right, I do thank you for being a great patient, and hygiene going out the door, you let us know, okay? All right, thank you.
Thank you.
All right, now, wash your hands. Can you state your name again for me?
Jada Clowers,
Okay, and your date of birth?
01/21/2000.
Okay, and I'm still Nurse Miracle. I want to check your armband as well. Okay, thank you. Well, the doctor had a couple more things on the assessment that I needed to do, okay? So I'm gonna check your atrial pulse, as well. So I'm gonna go ahead and do that.
Okay.
Alright. And can you lift your breast up, please?
Both or just one?
Just this one on this side. Okay, thank you so much. And I also want to ask you some couple of questions, okay? Do you know why you're here today?
Yes, and speak about my pain in my right knee.
Okay, and do you know who the president is?
Yes, Donald Trump.
Okay, and do you know what month it is?
Yes, it is the month of February.
Okay, all right, that's good as well. So I want to also check your gait, which means how well you balance and walking. So if you could stand up for me.
Okay.
All right. All right. And then I'm gonna demonstrate for you, okay? And then I'm gonna come back to this spot and I'm gonna want you to walk to me. So we're gonna do heel to toe, okay? So which is mean, this is how you're gonna walk to me, okay? Okay? All right. And then I'm gonna get you to turn around when you get here and do the same thing back to your chair, okay?
Okay.
All right. Are you ready?
Yes.
All right, come on. Okay. All right. All right. Now turn around for me. All right. Good job. All right. You
got some crepitness going on down here, okay? All right, I'll let the doctor know, okay, that I finished up the assessment for you. I do thank you, okay? If you need anything, let us know.
Yes, ma'am.
Thank you.
Thank you.